Good afternoon, and welcome to the Calhoun Parish Public Briefing on Hurricane Laura. My name is Dane Bolden. I'm the Assistant Parish Administrator here. Before I turn over to Mr. Grimion, I want to welcome some guests today, Ms. Charlene Edwards and Ms. Monique McCrary from American Sign Language Association. So we welcome and thank you so much for what you do. With that, it's been 3 weeks. We've come a long way, but you know what? It's a long road, but we're going to get there. I think it was the sheriff early on said it's going to be okay. And I can tell you, going around the community, it's going to be okay. So with that, I'll turn over to Mr. Grimion.
Thank you, Dane. I want to open with my safety message that I usually go over. I'm wearing one of them. Just a reminder that face masks are still mandated for use in Louisiana if you're in a confined space or if you're inside of a building. The other things to remember: wash your hands, sneeze into your arm, and maintain that 6-foot social distancing wherever possible. Those are the absolute best defenses against COVID-19. And I think Dr. Cavanaugh will be speaking later, but it is still in our midst here, and she will address that when she speaks. A couple other safety issues that we mention every time. Generator safety. Generator safety continues to be a big issue. Most of the fire departments have received some carbon monoxide monitors, and they'll be handing those out. But the best defense really is a well-installed and well-used generator. Traffic continues to be a problem. Stitch Gilroy probably will address that when he comes up. Proper use of cutting tools, chainsaws, axes, etc. And just a reminder, our curfew is still in effect from 7 p.m. to 6 a.m. Unfortunately, I have to share some information now about TD22. We are currently in the 5-day cone of error for this storm. People need to watch their news media very carefully. National Hurricane Center website is an excellent resource for you to get information about hurricanes. But our weather briefing today with Roger Erickson with the local National Weather Service office said that we could be experiencing some storm surge effects as early as Sunday. Don't be fooled by this only being shown as a tropical storm. I want to remind you that Hurricane Harvey was also a tropical storm, so let's not let our guard down. We've got a lot of things that are exposed right now, so be thinking through what your plans might be if this storm approaches. And with that, I will take any questions. Teresa? Dane?
Thank you, Dick. We will all be watching Tropical Depression 22 and keep an eye on that. Okay, today I want to call on Dr. Cavanaugh. It's been a couple of meetings since she's been here, and she can give us the latest on any medical-related items.
Thanks, Dane. Talk about a few things today. Once again, Dr. Lacey Cavanaugh, I'm the Regional Medical Director for the Office of Public Health for Region 5, which includes a 5-parish region here in Calcasieu, but I also cover Jeff Davis, Allen, Cameron, and Beauregard parishes. So one of the things I'd like to talk about today is boil advisories. We've all heard about them a lot in the past 3 weeks, probably more than we ever wanted to. But there are still a lot of questions that are coming up about what these really mean. I can tell you it's difficult to remember that there's a boil advisory in effect. Even at my own house, I find myself wanting to go to the fridge and get ice out of my ice machine. But I have to remember that if it is still under a boil advisory, that could be dangerous. The reason we do boil advisories is because the pressure in the water system drops whenever there is a loss of power or whenever there are problems in the lines, and that introduces contamination, particularly bacteria is what we're worried about in this case. So things like E. coli, and things like that are what get into the water system. And then if you drink or eat that or ingest it in some way, it can cause gastrointestinal illness. So nausea, vomiting, diarrhea, and it's very unpleasant, and it's not something that we really need in the community right now. So remember that even ice counts as water. When you're under a bowl of water advisory, you need to make sure you have a clean source of ice, and that you actually boil your water for 1 minute if you are able. And if you're not able to do that, you need to be using some source of bottled water or jugged water. So we are actually in our water systems, not all of them are under bowl advisory. We are starting to see some of those lifted across the region, which is wonderful news. But for those that are still under a bowl advisory, we actually have and continue to test for these bacteria throughout this event. And it's not just a precautionary measure. Some of them actually test positive for these harmful bacteria. And so we really need to make sure we're paying attention to that guidance. It's not just being done for precautionary measures. It's real. I'd also like to mention wells, because you've heard a lot of talk about the water systems, but not a lot of talk about private wells. These can also be contaminated, especially if there's storm surge and if they're if they're damaged. And so those wells must be disinfected and also tested for bacteria. And we actually have a new program where we have some free testing kits available for people who maybe had damage to their private wells and need to get those wells tested. So there are a limited number of kits. It will be on a first-come, first-served basis. Those will be housed at the Jeff Davis Parish Health Unit, which is 403 Baker Street in Jennings, because that is where our mobile water lab is currently set up. It will be open 8 a.m. to 2:30 p.m. Monday through Friday, and you can pick up a kit there. And then once you actually collect the sample out of your water system, you can bring it back to that location, and they will be able to test your water for bacteria out of your well. So I wanted to let folks know about that, because that is open to anyone affected by the hurricane, not just people in Jennings. It's located there because that's where the water lab is. So I'd also like to touch on the capacity of our healthcare system. You've heard a lot of talk over the past weeks about our hospitals. Our hospitals did get hit. I mean, they got hit pretty hard, and they are recovering. They are regaining services. In some cases, those are still limited. They are working really hard, and I'm really proud of them for how far we've come in 3 weeks with the services they have been able to bring back online. However, hospitals are only one piece. They're a very important piece, but they are only one piece of what we consider the healthcare system for the region. We also have nursing homes, assisted living facilities, group homes, many of whom evacuated and may have to return. Some may return sooner, but many of them may not be able to return for 3 months or 6 months or more if their physical structures were damaged. So that's a very important piece of the healthcare system that you may have not heard as much talk about, and they still have a long way to go. I also want to talk about some of our other outpatient services. So hospice, home health, some of those providers are starting to function in the region again, but you have to remember that the entire healthcare system, their staff who live and work here are also impacted personally, the same way that everybody else is. And so they may have damages to their homes for their staff, and so they're not able to stand up services as quickly as I know we all wish everything was back to normal today, but they are still facing some challenges to get those services operational fully. We're not at 100% there, Same with our dialysis centers. We have some that have started to reopen, which is wonderful, but they're not all open and functioning at 100%. Our DME companies, our primary care docs out in the community, many of our pediatric offices are still closed. Many of our normal family docs that you would go to see for your high blood pressure or your diabetes, they're not able to open because they may still not have power and or clean water. So I know everyone who's evacuated especially wants to get back, but it's not just power and water. It's also, at least from a medical perspective, all of those other things that you need in order to be able to return safely. So if you have medical conditions that require those other types of outpatient services, realize that they are not functioning at 100%. They are working very hard to get back there. But we still have to think of all of those other pieces as part of our healthcare system. So hospitals are definitely well on the way, and hopefully the rest will follow. As far as our public health units, because we have 6 of those in this region, only 3 out of those 6 are operational at this time, and the 2 that we have here in Calcasieu are still closed and not operational. So, just a lot to think about there, and wanted to touch on that. So the last thing I want to talk about a little bit is COVID, because, COVID was here before Laura and through Laura, and it is still here with us now. We really lost a lot of visibility that we had on COVID when the storm hit for a lot of reasons. One is people evacuated. And when they evacuated, they weren't thinking about testing, and the people who stayed wasn't thinking about testing, and we didn't have a lot of testing available because our healthcare system had to stop functioning like normal, during this response. But it's coming back. We are starting to have testing available. We are starting to see some more reliable numbers. But the evacuations also skewed our data, because people who are here temporarily working that have a permanent address somewhere else are still counting as a case wherever their permanent address is. And people who permanent address is here, but who may be evacuated to New Orleans or Baton Rouge or Shreveport, if their permanent address is here, they are still getting counted as a COVID case in Calcasieu. So because we have so many people who are from here who are gone, and so many people who are from everywhere else who are here to help us recover, that makes it very difficult from a tracking perspective to really have good visibility on how much COVID we have happening in this community right now. So it is something that we have to really pay a lot of attention to and proceed with caution. Just for reference, our percent positivity seems to be something that a lot of folks are interested in. And we had a peak percent positivity in July, and that was hovering around 25%. So that means that 1 out of every 4 tests that we did then, was positive. So that was an extremely high percent positivity. And if you remember, we got into a pretty dire situation in our hospitals where there wasn't a whole lot of space left, and we struggled to get through that. That percent positivity in July at 25% came down pretty significantly right up until the point that the storm hit. We were running, 5 to 9%, kind of right before the storm hit, and now we are it seems like we hit that bottom and we're almost on the way back up with our percent positivity since the storm. The most recent that I have is 10.3, although it changes on a very regular basis. It's reported out on the LDH website, so you can check on any given day and see what our percent positivity here is in Calcasieu, and you can also see what the most recent week average was. But I definitely am concerned because I saw it went down, down, down. We kind of hit that low point, and it now seems like we may be taking a slight tick up. I'm hoping that it's a testing bias because, of course, the fewer people that you test, if the sicker people are the ones who tend to get tested, then that will skew your percent positivity higher because people who are not sick are not thinking about getting tested for COVID right now, and definitely understand that. But those are all things to think about. The other thing to think about is flu. Flu season is going to be here before we know it, and flu does cause a lot of hospitalizations every year. So if we struggled to get through a huge peak of COVID in July, which is not our busy season for our healthcare system, then if we add the reduced capacity that we have right now on top of COVID, on top of potential flu, we just have to be very careful and cautious moving forward that we don't get into another bad situation with our healthcare system capacity. So that is why it is so important, and I urge folks to not forget about this. I know it's not what we want to deal with right now, but it is the reality. And so we really can't forget about COVID, and we have to continue to pay attention to those mitigation measures that Dick talked about, which includes, wearing a mask, washing your hands, staying 6 feet apart from people, which is one of the most important things. So please don't forget about those. I'd also like to mention that we have brought back the COVID testing in partnership with the National Guard. It is at 3236 Kirkman Street, which is at our Calcasieu Parish Health Unit. It's 9 a.m. to 7 p.m. daily. That does include the weekend, so that does include tomorrow and Sunday. We are using the eTrue North Lab, which has right now a 48 to 72 hour turnaround time. And we are also providing vaccines during some limited hours. The vaccine hours are 9 a.m. to 2 p.m. Monday through Friday, and that's for Hep A, Hep B, and tetanus. We are starting next week on Monday, also going to expand the COVID testing. We will have nurses on site to be able to test for pediatrics if that's needed, which is a new development, because previously our National Guard sites only would test ages 16 and above. So now it'll be ages 2 to 15 as well, just during those 9 a.m. to 2 p.m. hours when we have those nurses on site. We also have some new capability with first responders being able to get a rapid turnaround time test. And for that, you do need to bring your identification showing that you are a first responder. So with that, I think it's also important at this time to think about our mental health as we move into recovery. So I'd like to introduce and bring up Tanya McGee, who is the Executive Director of Imperial Calcasieu Human Service Authority, and she'll be talking a little bit about mental health, and then I can come back and answer questions after.
Thank you, Dr. Cavanaugh. As Dr. Cavanaugh said, I'm Tanya McGee. I'm with Imperial Calcasieu Human Services Authority. We are the largest behavioral health provider in the 5-parish area. We receive state and federal funds to be able to provide those services to our community. So I just wanted to talk about, Dr. Cavanaugh called and said, could you give us a synopsis of the mental health status of our community? And that really is a difficult question to answer. What I can say is a few months before Hurricane Laura, while we were dealing with COVID, in talking to our parish coroners, we saw the highest documented deaths by overdose and deaths by suicide ever documented on record. So going into this disaster, we already had a very fragile community when it came to mental health, substance abuse, and developmental disability services. One of the things that I also wanted to state too is with any kind of trauma like this, you right now we are all in response mode. Dane and I were just talking about he's been in response mode. He hasn't had a day off since this all started. Glad to hear he's taking a day off tomorrow, but it's to clean out his house. So everybody needs to remember in dealing with this, we're in response mode, but that anxiety and that PTSD and that trauma is going to come. In fact, a lot of people are already reporting just seeing the blue roofs back on is bringing up some PTSD in regards to Hurricane Rita. So it's just really important for everybody to be mindful, not just of their physical health, but also their mental health status. For those folks who, just like Dr. Cavanaugh stated, our entire healthcare system has taken a hit, including the behavioral health system. Our inpatient psychiatric units have been closed down. Our 46-bed substance abuse facility has significant damage and is currently closed. So we have limited capacity right now to serve some of the folks. So if folks are evacuated and if you are unable to sustain yourself, then we know you want to come back into this area, but we need to make sure that we have all the resources available to take care of you. I can say for Imperial Calcasieu that 4 out of our 5 clinics are open and operational. Our Lake Charles Clinic, which is next door to Moss Regional Hospital, Moss Memorial Hospital, on Kirkman Street, is running on full generator power, and our pharmacy's open. We also have clinics in Allen, Beauregard, and Jeff Davis that are open as well. Right now, we're unable to provide services in Lower Cameron Parish, and our Sulphur Clinic suffered some damage. But what I wanted to let folks know is that if you are in need of mental health and substance abuse services, that you can call 475-3100. And we have folks around the clock that are ready to serve you. That goes for our developmental disabilities division as well. Our developmental disabilities office was in the tower. So we had substantial damage to that building, but our staff, mainly because of COVID, are able to work remotely and have learned to work remotely, and we've been serving our population. So just some things to keep in mind. I also want to point out, too, that as power's coming back, providers are coming back, and if people are in need of their medications, to first reach out to your provider. And then if you're not able to get the resources you need, to please call our Imperial Calcasieu office, and that number again is 475-3100. I need everybody, too, to be mindful of friends and family as we go through this recovery process. You might not see or sense the levels of depression and anxiety that may come on, but it may be something that's going to have long-lasting effects. So let's just take care of each other as a community. And remember that 211 is an amazing resource. We have 24-hour crisis counselors available by just dialing 211. So that's also a resource available for folks in the community.
And I'll take any questions.
Do you have any numbers on overdoses and suicides since the storm hit?
I'll let Tanya answer that one.
No, not at this time. The numbers that we had before were from COVID, but we have not gotten with our local coroners to see what that number is now.
But you have a sense that it is worse or getting worse or something?
Well, so since we saw a marked increase right before the time of the disaster, and usually after times of disaster, you see an increase in those rates, we're kind of foreshadowing that that's going to be the case as we move forward. A lot of times when you think about the deaths associated with a disaster, you think about the flooding or what happened right at the time of the disaster and then like the carbon monoxide. But what you don't know or what you don't get a feel for is 6 months down the line, that suicide that happened because of the trauma associated with the disaster. So sometimes that's kind of hard, like Dr. Cavanaugh was talking about, kind of hard to track and trace. But that would be something that we would have to get data from our local coroners. And they're a little busy right now.
And are the services you provide free, and are they for everybody?
Yeah, so Imperial Calcasieu receives state and federal funding, which means that we can serve anyone regardless of their ability to pay. So if someone has private insurance, we take private insurance. We also take Medicaid and Medicare. And if they don't have any forms of insurance, then we have funds to be able to provide those services to them as well if they're indigent. You're welcome.
I want to thank both of you. You've been with us every step of the way from COVID through Laura, and we really appreciate your expertise. With that, it is time for I'd like to call on Chief Deputy Stitch Gilroy to give us the latest on law enforcement.
Thank you, Dane. According to our stats, September the 16th and 17th are very similar. On the 16th, CPSO had 4 arrests. Lake Charles Police had 4. Westlake Police had 1 for a total of 9. CPSO had a domestic abuse, a weapons violation, two of those, and an in-state detainer. LCPD had a looting, burglary of an inhabited dwelling, and a sex offender. Westlake Police had a weapons violation. On the 17th, same again, 9 arrests. CPSO had 3, 1 domestic violence, a weapons violation, and an in-state detainer. LCPD had 1 looting and 1 aggravated second-degree battery. Vinton Police had a domestic abuse. Iowa Police had a weapons violation, and Cameron Parish Sheriff's Office had a detainer. And over the last 2 days, we've made a number of curfew stops. McNeese State Police has had 20 curfew-related stops. Louisiana State Police has had 160 curfew-related stops with 3 arrests. Lake Charles Police had 122 curfew-related stops with 1 arrest. Westlake Police had 30 stops. I can tell you we're going to continue to monitor our nighttime traffic. As Dick said earlier, the curfew is still into place. It's 7 p.m. to 6 a.m. We've had a number of businesses that have called and inquired about us changing the curfew. We're going to leave that the same for the rest of the weekend. We will reevaluate that on Monday. Also, there's been a number of wire thefts. These utility companies are putting up these power poles and stringing new wire. Well, their old wire they leave there and they come back and they get it later. Please do not take that wire. It belongs to the utility company. If you are caught with that wire, you will be charged with theft. So I want to reiterate that again. Please do not drive around picking up wire off the side of the road. It belongs to the utility company. Traffic is what it is, and you could help us a great deal. You could help the utility company a great deal by limiting the amount of time that you spent on the road. It just clogs up the road and causes more and more problems. So if you don't have to be on the road, we're asking you, please do not be on the road. Let's help our utility companies. We're about 50-something% utility, getting our utilities up. We need to get that up more. Is there any questions for me, Teresa?
I just was wondering for clarification, like say you see a 6-foot piece of wire that's not attached to anything laying on the sidewalk and you're thinking you should, pick it up and throw it away. Are you talking about wire that's still attached to something or just all wire that's laying
all wire? If it's on the side of the road, it belongs to the utility company.
So leave it there.
They need to be the one to pick it up, not you.
Okay, thank you.
Okay, thank you. At this time, I'll bring up Colonel Raleigh with the Louisiana National Guard.
All right, good afternoon. Colonel Raleigh. I'll be briefing for the Louisiana Army National Guard. Currently, we're still managing 10 pods in the Calcasieu Parish area. What I've had my team working on is trying to get a weekly average or a 7-day average starting from Friday of last week until Thursday of this week to kind of give a good, clear picture of what we are distributing on a daily basis. So we're working through it, looking at Grace Harbor. Average daily from a weekly count is 974 bottles of water, 246 MREs, 419 bags of ice, 0 tarps. Iowa, 4,230 bottles of water, 6,022 MREs, 650 bags of ice, 0 tarps. LLCC, which is the Civic Center, 4,032 bottles of water, 9,216 MREs, 1,800 bags of ice, no tarps. Sulfur, 576 bottles of water, 1,728 MREs, 450 bags of ice. At the Gillis site, 684 bottles of water, 1,152 MREs, 225 bags of ice, 0 tarps. At DeQuincy, 576 bottles of water, 572 MREs, 900 bags of ice, no tarps. Vinton, 288 bottles of water, 576 MREs, 220 bags of ice, no tarps. At Washington Marion, 586 bottles of water, 592 MREs, 675 bags of ice. At Westwood, 1,152 bottles of water, 1,153 MREs, 675 bags of ice, no tarps. At Park Plaza, 2,880 bottles of water, 576 MREs, 1,350 bags of ice, 0 tarps. The common theme is nobody really wants tarps. So you still see kind of a weekly average. What we did was take each day, and then we used that 7-day average, then we averaged out the weekly total. That should kind of give the parish officials and the citizens a really good metric to see, how effective these locations are and if the public is still using them. We continue to maintain 21 security sites supporting the Calcasieu Parish Sheriff's Office day and night. Also, Task Force Bus has evacuated 355 packs and 29 pets so far, but the last evacuation was 2 days ago, and that was only one person. We brought in extra engineer work teams. We basically had a surge around the McNeese campus. We have identified 33 sites for cleanup. 4 are currently in progress, and we've completed 16. Pending any questions, line is set.
Thank you, Colonel. I did not know that tarps were a hot commodity, and I didn't know the MREs were that good. So that's great. We're going to go into utilities, and I have a couple of updates. I just received an email from Energy. I believe Margaret was caught in traffic. Again, this is from Energy. We continue to make progress in restoring power to Calcasieu and Cameron Parish customers with power availability to approximately 75% of our customers. We restored a number of circuits last night, including the North Lake Charles area. Please make sure that you have damages to your meter base and equipment at the weatherhead, and below that, you hire a qualified electrician to help you with the repairs. We thank you for your patience and very much appreciate the cooperative effort to repower and rebuild our fine community here in Southwest Louisiana. 75%, I'm sure the mayor will say that if you'd have said we've been at 75% 2 weeks ago, probably wouldn't have believed that statement, but that's some outstanding work by Energy. We also have a statement from Beauregard Parish, Beauregard Electric, as of today at 10 o'clock, 33% of Calcasieu Parish customers have had power restored. So that number continues to rise, and that's mainly in the Moss Bluff area of North Parish. We do have a sudden link update, and it's a really quick bullet point, but today in Baton Rouge, the Joint Commerce Committee, which is chaired by Senator Ronnie Johns, met at the Capitol to discuss information relative to Suddenlink Communications and their performance during Hurricane Laura. We do not have the results of that meeting unless the mayor has some lately, but at this point we do not have the results of that committee hearing, and as soon as we can get that, we will report that to everyone here. Any questions on utilities? Thank you. Okay, at this point I want to turn over, kind of do a little individual assistance updates. So I'd ask Keith Jones with FEMA to come on.
Thank you, sir. Appreciate it. Before I get started with our numbers, I just want to say that this has been 3 weeks, a little over 3 weeks since everything happened, and I've been here every day. A lot of us have. And just the amount of recovery and the amount of debris removal and the amount of getting Lake Charles back to where it needs to be has been an excellent work by your local officials and all the volunteer organizations and everybody who's working hard every day. So if you're still evacuated and you're out there right now, just know that there's a lot of work going back here with people without power, without having to boil water to help bring you guys home. Some numbers from FEMA. In the last couple of days, we've had 2,056 registrations since the last brief. Brings that total number of registrations to 81,700. So far, FEMA has paid $92.9 million towards housing assistance right here in Calcasieu. Now, I'm just going to expand on the FEMA registration process a little bit. So a lot of this isn't new information, but it might be very helpful. We've talked about the many ways that you can get your registration taken care of and also do some updates on your claim. You can call 1-800-621-FEMA. That's 1-800-621-3362. For the TTY number is 800-462-7585. And we're going to talk about disasterassistance.gov and the FEMA app. Now, the reason I say that is because today I was called out to the Calcasieu Parish School Board site, and I also went to the Sulphur City Library site. The Calcasieu Parish School Board, there was a 400-car waiting line, and we were going to send some vehicles over to Sulphur, but they said no, you have 200 cars waiting in line here. So that's for your in-person assistance, and these are still great options. But most of the traffic was in for turning in receipts. For in-person service, these are your two options, but if you have the FEMA app, and I understand a lot of you don't have very good cell phone service where you're at or access to Wi-Fi, but if you can find good service or access to Wi-Fi, you can upload your receipts if you already have a registration to the FEMA app. If you need a FEMA app, you can download it by texting the word Android or the word Apple, depending on your advice, to 43362. And to ensure your documents end up in your file, you should write the disaster number, which is DR-4559-LA, and your FEMA registration number on every receipt. So if you're pulling up to one of our drive-in document centers, or if you're putting it on the app or going to disasterassistance.gov, make sure you write the disaster number, DR-4559-LA, and your FEMA registration number on every receipt that you upload. That'll just make sure that it ends up in your file and that you're going to get anything that's deserved to you. So I just want to go through some of the sites again. The drive-up services, the drive-through services at the here in Calcasieu Parish are open from 7 a.m. to 5 p.m. They do initial registration, some technical assistance, and the document uploads like we talked about. They're at the Calcasieu Parish School Board at 3310 Broad Street here in Lake Charles, or the Sulphur City Library at 1160 Cypress Street in Sulphur. They're open 7 a.m. to 5 p.m. every day. So if you get behind a line and you want to wait till tomorrow, that's fine. Because right now, I think today, Jerry, there were like a 2-hour waiting line for people. It was backed up all the way to McDonald's. So they're open 7 a.m. to 5 p.m. every day. Your walk-up services for initial registration or some help with your registration. DeQuincy City Hall at 101 South Pine Street in DeQuincy, and Morning Star Baptist Church at 1503 Nichols Street in Vinton. They're open from 9 a.m. to 5 p.m. every day, and you can walk up and get assistance there. If you're not here locally right now and you're still seeing this, the FEMA app, I very much suggest that you download it. They have locations for all drive-through and walk-up service centers throughout the state, so you can find assistance near you, or you can use the website FEMA.gov/disaster/4559, and all those documents in there will give you every link, every how-to guide, every bit of information we've covered in the last 3 weeks. You can go there and get and read up on all the information you have. I don't really have anything else to add today, but I'm sure there's some questions. Teresa? All right. Thank you very much. Have a great weekend, and everyone keep working hard. Thank you.
Thank you, Keith. Job well done. At this time, I turn over Mr. Ed Bush with the Red Cross.
Good afternoon, everyone. As always, absolutely my pleasure to be here today and continue to be a part of this tremendous relief effort. Priorities of the Red Cross: sheltering, distribution of food, individual assistance, and communication of needs. So I'll talk sheltering piece again because it's important for here because those shelters aren't here, but your people are being sheltered somewhere else. So I always want to try to keep you updated on that. So we continue to work in support of DCFS, that's the Department of Child and Family Services, for all sheltering needs. The Red Cross is currently managing 42 non-congregate shelters, that's hotels, for a total of over 5,200 rooms and approximately 12,000 clients. And those hotels are primarily in New Orleans, with a handful in Baton Rouge and a handful in Shreveport. The other big piece is the state-to-state transfer, and the Red Cross is in full support of the Texas-Louisiana transfer and the coordinated effort for the shelter consolidation and the movement of those clients either to new hotels in Texas or across the border into Louisiana. And we're staying very close with the state EOC, their GOSEP in Baton Rouge, DCFS, and then local parishes and officials here on the ground, as we have a coordinated effort to reduce the shelter population in conjunction with those communities that are opening up in those cities that are now livable. Trying to work that whole process of getting people out of the hotels and into those parishes and their homes where they can now, as those parishes come up green and are livable. So points of distribution, primarily food. Big picture here real quick. Statewide, Red Cross has currently maintaining 25 feeding sites in 14 cities spread over 3 parishes. And a vast majority of those are all in southwest Louisiana. Today we'll feed 11,000 people, 11,000 meals provided today. And that doesn't include the meals that we're providing in the hotels for all those folks staying in the hotels. So here in Calcasieu, we have 10 feeding locations, and I'll run down that list now. Some of these have been very enduring from the start. So 2401 4th Avenue, that's Huber Park here in Lake Charles. The Sam's Club at 2025 Sam's Way, Lake Charles. The Dollar General Strip Mall at 935 3rd Avenue, Lake Charles. Mount Olive Baptist Church, 3007 Enterprise Boulevard here in Lake Charles. And there's a drive-through site at 276 Old Highway 171, Lake Charles. And then that drive-through site is also being used as a launching point to push meals into Moss Bluff as well. A few other sites. 203 Grand Avenue, Our Lady of Catholic Church there in DeQuincy. 4501 Maplewood Drive in Sulphur, that's a First Baptist Church. And 300 South Hazel in Sulphur, that's McMurray Park. And then there is a location in Vinton as well, on Horridge Street, the Vinton Knights of Columbus building there, we're feeding from there as well. So as far as the disaster emergency supply drops go, we're no longer doing those major drops, and now because it's kind of individual locations and individual requests, what we call hot shots. We're just going point to point for those specific locations that people might need some supplies dropped. Damage assessment is functionally complete, except for some specific addresses in those very remote locations that were hardest hit, and we've got people on the ground there making sure that we haven't missed any of those key locations for damage assessments. A quick swag as of this morning when I looked at the numbers here in Calcasieu, it's over 2,000 residences that were classified as destroyed, 2,211, and just over 4,500 sustained major damage, and that's important because it's those residences that then qualify for immediate assistance through the Red Cross. And then finally is the communication of needs. So we're able to flex and kind of shift resources where those needs are best met still to this day, because we're trying to stay close to all those parish officials and all those local points of contact that we have that are able to point and kind of redirect as needed, and we continue to do that today. Workforce, currently approximately 700 Red Cross staff and volunteers from across the United States are on this recovery mission. And all that, I mentioned volunteers, and I will always put out a need. We absolutely still have a continued need for volunteers. Anyone who's interested in volunteering to be part of this recovery effort, we make it pretty easy. You can go to the website, www.redcross.org, or they can call 1-800-RED-CROSS. And again, we need volunteers both on the ground and virtually. We'll take any help as long as they're of good mind and good spirit and willing to give a hand. That concludes my briefing unless there's any questions. Yes, ma'am.
This week, we, throughout the week, received numerous calls from people who are being evicted from their apartment complexes. So these are people who left and came back thinking that they had a place to live, and they're being evicted so that the apartment complexes can make improvements and that sort of thing. What, if any, assistance can the Red Cross provide for some of these people who are suddenly displaced?
Yeah, I don't know certainly the specifics of any of that, and I wouldn't want to kind of give any type of answer that seems to be pretty overarching. I would just encourage all those people to raise their hand, identify themselves with their parish OEP, and let us know, and then we can assign caseworkers to kind of help and do what we can case by case by case. I would imagine that every one of those is a little bit different. But there's a number of means of things that could happen, and we just need to get that information. Anything else? Okay. Thank you.
Thank you, Ed. The Red Cross continues to provide a very valuable service to the community. With that, I want to, our last item on the agenda is our Mayor Nick Hunter of Lake Charles.
Thank you, Dan. Good afternoon, everyone. This is an exciting thing to say that City Hall will be open on Monday, September 21st. And it's kind of one of those things that we take for granted every other day throughout the year. But just to be able to say that City Hall will be open is an exciting thing at the moment. I want to encourage anyone that does have some business that needs to take place at City Hall. If you know the city employee that you need to speak with, call ahead, make an appointment. That's always suggested. However, for those that may not know a specific person or a specific floor of City Hall, if you have any questions, the Mayor's Action Line is still operating Monday through Friday at 8 a.m. to 5 p.m., and that number is 491-1346. Just a reminder, many permitting questions or permits can be submitted online at mypermitnow.org. Transit services still remain closed until further notice. With Entergy, I know that Dane gave a quick update. I'll just tell you that I got a text this morning from a very happy person who lives on Fitzenrider Road, which is about the most northernest road in the city of Lake Charles. And that text was to say that they had power. And I was very excited to get that text, as they were. So Entergy, I believe, continues to move mountains. The job is not done, and they realize that until every citizen is able to receive power again. They realize that, and so does the city. I'm very excited that the Small Business Administration's administrator, Javita Carranza, will be visiting Lake Charles on Tuesday, September 22nd. She'll be doing a tour of the city to see some affected businesses. And I just want to remind people that we discuss FEMA a lot, and FEMA is certainly a major, major component of our recovery. But the SBA is also a big part of our recovery. I have given my story, and I'll say it again. In 2005, when I was in my early 20s trying to run a restaurant and Hurricane Rita hit, if not for the SBA, I probably would not have any ownership in a restaurant today. And so the SBA was good to me 15 years ago, and I believe we can see that story replicated amongst many in Lake Charles who need it so badly. And remember, not only business owners, but homeowners. A lot of us are getting some rude awakenings and some wake-up calls as to what those policies really say regarding our deductibles. And this is where the SBA can come in and help you. I had a touching moment today that I want to share. I visited Southwest Louisiana Center for Health Services on Opelousas just to check up on them, and they were providing some services to our deaf community locally. And I thought that was a beautiful thing. There was probably about 9 or 10 individuals from Calcasieu Parish that were there. Very easy for them to communicate with some of the individuals that came in to make sure that they were connected with the services they needed. And I was able to just kind of have some fellowship with them for a moment. And that was a very special moment. And I want to thank Southwest Louisiana Center for Health Services for everything they do. Lastly, I will say that we have had reports about individuals living in tents in certain areas throughout the city. Obviously, that's concerning for us as city officials, so staff went out to check on those individuals. There may be exceptions to this, but without any deviation, the people that we encountered were all here after Hurricane Laura. They were workers that moved to Lake Charles after Hurricane Laura, and for whatever reason, they set up tents in certain areas of the city. So these are not Laura evacuees. If someone is a Laura evacuee, if someone is from Calcasieu Parish and they need assistance, we can provide that. We have been providing that in coordination with the state. In fact, this date continues to get moved a little bit further and further down the road, which in my opinion is a good thing. But at this moment, until October 2nd, if people want transportation out of the city of Lake Charles to a shelter, we can provide that in coordination with the state. So once again, our city staff went to check on those individuals, asked them if they needed anything. We provided them resources. We have lists of resources, but a lot of them just said, well, we're here to work, and this is where we decided to set up our residence for the moment. So we would encourage people. We're very thankful that people are here working. We need that. But we would also encourage people, when you do decide to make a decision, especially related to your job, if you're making a decision to go somewhere and work, housing is part of that decision. And in the same breath that I say that, I realize that housing is a major issue here in Lake Charles. But if people are coming here to work, they really need to think about those housing options. There are individuals that are literally commuting back and forth between Southeast Texas, South Central Louisiana daily. And so we are asking people to figure out those options before you come to Lake Charles and before you decide that a tent is what is your option for housing. So I just want to make it very clear. We appreciate people's concern. We're concerned anytime we see that, but our city staff went and checked on those individuals, and again, I'll be very clear. They arrived post-hurricane, and they're here for hurricane construction jobs. That is the vast majority of everyone that we encountered. And that's the end of my report, unless there's any questions.
Is it your impression the people in tents always planned on staying in tents, or that they are in some way stranded because they did not get the work that they were anticipating?
No, they came here with tents. So if you travel with a tent, that's usually a pretty good intention that you intend to use that tent. And again, I get it. I know that there's a lot of situations right now with our economy, with COVID, with the lack of housing here. I get it. But if you're coming to Lake Charles and you're immediately setting up a tent, and that is your first solution for housing, we're encouraging people to try and search other solutions, and we are helping them find other solutions.
Also, in light of Dr. Cavanaugh's comments, I'm wondering, are there any parts of the Lake Charles water system that are still under a boil advisory?
Yes, I'll be very clear. All Lake Charles water systems are under a boil advisory, and they will be until power is restored to all of our water plants. But we are actively working with DHH, and DHH has been very responsive and communicative with us. So I don't want to give an ETA on that, but I will say that we are very encouraged by a lot of the testing results that we're seeing right now. Okay, thank you so much.
Thank you, Mayor Hunter. This concludes the daily briefing, unless there's any questions. Teresa? Thank you. I do not want to end on a negative note, but I would encourage everyone to really stay tuned to the television, radio, social media to monitor Tropical Depression 22. Tropical storm now. Just got the latest update from Mr. Grimion. Monitor it, please. We'll continue to give you updates. It's a weekend, though. If you can have time, spend some time with your family. Thank you, everyone, for attending.